there are so many unclear and doubtful information that to consider this pandemic as a gigantic problem from the point of view of the health of our citizens is different than considering the issue that this pandemic is creating a huge amount of problems, which are very different from the real situation. I mean, if you consider this in terms of numbers, you should consider that so many people, even in USA, die in a year in a larger number because of suicide, because of AIDS, and because of malaria all over the world. And nobody talks about this. If you consider what is written in the newspaper about Italy, you have to consider that the last year, according to the official numbers of our Office of Statistics, the number of people who died for a pneumonia were much more the last year instead of this year. So it is surely a tragedy that so many people in the same moment go to a hospital. It's a tragedy that it's extremely difficult for hospitals to handle such a situation because it's not easy at all. It's a disaster, of course, that people can die. But between the concept of morbidity, which means how many people get sick, and more precisely, how many people get sick in such a short amount of time, and how many people die, if you consider the entire number of people which is infected by this coronavirus, it seems that the percentage is more or less around 0.15, which is the common number for a common flu. So I insist, something is the social issue, something is that our health system, which in Italy is free, as you know, is completely full of people going there all of a sudden and all together. Something is the economical side of it, which means that a lot of people will lose work, that we will have to face a financial crisis which will be more serious than the one of 12 years ago. Something else is the panic, which I hear daily from patients calling with the fear of dying for something so severe, which is not. They made some investigation in a few villages in Italy, small ones, where it was possible to investigate the entire number of these people close in this village, and the 80%, the 78% was infected with no symptoms at all. The ones which are producing symptoms in the large majority of cases overcome this problem with no problems, with no medicine at all, because we still do have a good immune system which is working, and which is the most important part of our experience of being on this planet. And you know, this pandemic occur more or less every 50, 100 years. And this is in some way a problem, but this is in some way something natural. So first of all, what I like to say to my clients, to my patient is, don't be that afraid, because we're not talking about anything which is such a tragedy, please. Then, you know that in Italy, homeopathy is tolerated, is not completely legal. So differently from India and from other countries, where in some way it is possible to work in hospitals and to work with very severe cases, in Italy we can't do anything like this. We're not allowed, even if I am a doctor, to work in any hospital. You could even lose your license very easily. And this is a daily problem that we have. So what I can do is to share my small experience as a doctor who is working at home and who mainly treated people which are not positive but symptomatic to this disease and which were requested to stay home. There is another clarification before that. The greatest majority of my patients, I mean patients which were already patients of me since years ago, which I considered reacting well to what I consider their constitutional remedy, I still treat them with their constitutional without changing the therapy at all. It was not necessary. The ones where it was necessary to change it because they were not reacting to what I thought it was their constitutional remedy are cases where I'm seeking for another constitutional, because I believe, according to what I've seen in the last 40 years, that when a remedy is a constitutional one and works very well, you don't have to change anything. And this is what I see in these days with this pandemic. So what I did was to try to test this idea of the genus epidemicus that Hahnemann had at this time. But I think that at that time, the genus epidemicus was an interesting hypothesis that for Hahnemann was something extremely important because it was able to be acknowledged a lot by the French government because of this. So I wanted to test this. So what I did was to ask to my patients in quarantine, to friends of them, to relatives of them, which were the largest amount of cases which I treated, if they would have liked to try with homeopathy without taking any other kind of medication. So I'm talking about patients which I never met before, okay? So what I did at the beginning of this problem, which was more or less 2 months ago, with the first 25 to 30 patients, I did a lot of work collecting the main common basic symptoms, which means that in what we saw in Italy, in this small area, because it's a small part of Italy which is affected, the majority of problems in terms of symptoms were fever, headache, pain in muscle, joints, or something like this, were problems of cough, which was mainly a kind of very dry and disturbing cough. And I try also to collect from them a very general way of reacting emotionally to this situation. So on purpose, because I had to do a symptomatic work seeking for a possible genus, I repeat, I wanted to focus on very evident symptomatology, which was the most common kind of symptoms that were presented. So working on this, in the first 25, 30 cases, I came out with an analysis of those symptomatology, and I prescribed on the basis of this, of course, from the point of view of my experience as an homeopath. And the remedies that came to my way of thinking were Chininum Muriaticum, then Grindelia Robusta, and then Camphora. So I tried to use that. And I consider as a kind of paradigm for considering those people reacting really well to this prescription, if when the symptoms started, they had to take the remedy as soon as possible, repeating a dose of this more or less every hour, not when they were sleeping, and only the cases that not more than in 4 days were really feeling much better were considered well responding. Because you know, as I told you, that in the range of 7, 12 days, in the majority of cases, the disease go away with no medication. So only if there was an evident, clear reaction from the general point of view and from this point of view of those few symptoms which I told you, I wanted to consider these cases the good responsive one. So it was interesting to see that our way of thinking as homeopaths is more and more and more and more differentiated from the common approach of conventional medicine. Because if you try to read, even in medical journal, something about this disease, what was the old let me say, the old way of taking a case, the old way of analyzing patients from the point of view of the observation of what's going on. It seems to be completely disappearing from the more recent common medicine, which means when I ask her, tell me something about the modalities of this fever, nobody cares if the fever is in the morning, in the afternoon, in the night, if it is a constant, if it is changing in a different moment of the day, and if it's changing the kind of cough and things like that. So it was extremely hard to find out in journals information about this. I was only able to get this from my patient. And the reaction was very good.
Wonderful.
Very good. If you want to know the numbers, I can send you a paper with that. But at the moment, I treated 102 patients, and they recovered very well in not more than 4 days, 71. No reaction in 21, a doubtful reaction in 9 cases, and only 1 was hospitalized and went out of the hospital with no problems after a few days. So I consider that this can be interesting numbers.
That is wonderful, Massimo. And what made you to choose Chininum Muriaticum over Chininum ars?
Instead of Chininum arsenicosum?
Yes.
So the main issue was that, according to my experience, in Chininum Muriaticum, there is an interesting embittered, angry side, which is evident in those patients. That was interesting to study because I spoke with some other colleagues from Seattle, for example, and they told me our patients are very mild and very quiet. They seems to be extremely responsible. They know that they are sick. They are happy to stay home and not to infect the other people. I said to them, okay, I would like to know if this is because your patients are very mature, because they go to an homeopath and probably they have a certain perspective of life. I don't know if it is because those are Seattle people, but these Italians in that part of Italy were extremely embittered, very angry. And the most common reaction was a strong emotion of saying, I did my best not to be infected. I behaved properly. And because of someone else's fault, I am like this. So it was not reported and as a something, you know, those kind of things could happen. There was really a sense of angry feeling about that, very embittered, very fault finding about those other bloody bastard people who did something so unpolite. This is a well-known racist area of Italy. I have to say this, but I don't know if this is just because of that. And also, if you consider some other clinical symptom, this specific kind of frontal headache with a strong sense of something which is pressing, with the kind of neuralgic pain, mainly in this area of the eye, it was a common issue in these patients, and this is a clinical symptom of Chininum Muriaticum as well.
Thank you so much, Dr. Massimo.
But we have to remember that at the time of Hahnemann, the hypothesis of the existence of a genus epidemicus happened in a small number of people, even if it was large for that time, and just in France. What we are facing now is something which is a pandemic, not epidemic, which means all over the world in practically every country. And it seems also that the virus is changing. So it's known from the medical point of view, from the virological point of view, that coronavirus is a very changing virus. Changing in terms of time and changing probably in terms of places. So it is extremely important to consider other comorbidities, which is not only which other kind of diseases those people were infected about, but also in which kind of environment this situation is taking place. It is still unknown in Italy why that part of Italy was so affected, when the largest community of Chinese is something else, somewhere else. So the largest community is in Florence, in Tuscany, and then in Rome. And it was around Milano, this huge explosion of cases. And it's not that easy to understand. You can say that it was because in these hospitals, they were not so good in keeping this closed, but I don't think that this is sufficient to understand the problem. So I think that we really need a wider perspective. It's very possible that in other countries, those symptomatology can be very different.
Yes, Dr. Massimo. And we are receiving many requests, like their families, they are in Italy, like some of them in USA and some in India, or their friends. And they were in such a panic state that to reach homeopaths and get services. It was so nice that you are doing amazing job treating over 100 cases with your knowledge and with your humbleness and kindness. That is so nice, and we are sharing your information that
it was not that difficult, believe me. You just need time to make video conferences and stay at the telephone. That's it.
So kind of you, Dr. Massimo. And what do you say, the takeaway message to any people um, to help in Italy or any place? As you have covered so many things, Dr. Massimo, all everything but
First of all, no panic,
yes.
because it's important to differentiate. I insist on this concept. What is a financial problem? What is an important, serious social problem? What is a problem from our health service? And what is a problem of your health? So in terms of health, this is not such dramatic, it's not the monster that they try to describe. The great majority of people overcome this with no symptoms at all. This is important to be known. Otherwise, they consider this something which is really an anguish, a terrific experience, which is not like this. This is the most important issue. And then to consider that it's important to be brave and to follow the instruction of our government, because at the moment, the best way to control what will be an infection that will affect everybody in Italy, this is for sure. We have to develop a kind of immune system for the entire population all over the world. This is typical of pandemia, but those kind of things happen always. And this is not as tragic as it was 100 years ago when 50 million of people died in Europe because of that. So keep quiet. It's not such a bad situation.
And Dr. Massimo, like 200 or one, which potency you have seen much response and depends upon?
I can't answer to this question because to get these remedies as quick as possible in that moment was not easy at all. You should know that in Italy, differently from your country, we are not allowed to give the remedy to our patients. They have to go to pharmacies, to apotheke. And our pharmacies in Italy are not so good at all, because very often they just sell 20, 30 remedies and not more than this. And you know that Chininum Muriaticum and Grindelia are not one of the most common remedies that you can find out in every kind of pharmacy. So I suggested to my patient to get what they could. Someone took a Q1, which were the most, someone has the 30, someone has the 200C. So they took what it was possible to purchase. Well, I suggested them to put a few drops, few globuli in 1 liter of water, to shake it and to take a sip every hour for a few days. This is what they did.
And Grindelia in mother tincture or in potency form?
Potency, absolute impotency. The most of them were Q1, because at that time it was easy to get remedies from Austria, which I commonly do for my patients. Then also it was not an issue because almost 2 weeks ago they had to close the custom, and so it was not that easy to get it as it is now.
Wonderful.
But I mainly work with Q potencies, so it was mainly Q1.
Oh, very nice. And thank you so much for having with me today. And this is Kavitha Kukunoor, Homeopath from USA, President and CEO of Kavitha Holistic Approach. And thank you so much once again, Dr. Massimo, for
My
sharing
pleasure.
your immense knowledge, which really
Have a nice
greatly
day.
appreciate. Thank
Have a
you.
nice